Heads up already with regards what we are talking about today on Mind and Body. It's time to learn. It's time to ensure that you grasp the information that we have to share with you today on Mind and Body. So it happens here at this time, and of course today we've got a doctor in house to educate and enlighten us with regards something that's barely talked about, and that is cervical cancer. You hear about that in this part of the world, and how that, these days girls are asked to vaccinate and, is it vaccination now, or take some sort of vaccine to help them later in their lives. Now, the big question that we'll get to shortly would be what happens to those who didn't take it at the particular age they were supposed to. Anyways, we've got Dr. Mercy in-house. Dr. Mercy Omachi is the person we have today to talk to us about cervical cancer, and of course would continue the conversation. Remember, you can join this show by sending in a text or WhatsApp message to 090-9705-4450. That's why you send your text and WhatsApp messages to, so that the conversation continues. So anything you're not clear on, anything you want to ask, any of the signs and symptoms we'll delve into, you feel like, I've got a question for the doctor, make sure to ask. Good morning and good to have you here, Dr. Mercy.
Thank you very much. Thank you for having me.
All right. So we're about to talk about something that's, I guess, is really important. And why do you feel the need for us to discuss a topic such as this?
All right. It's very important to discuss this topic, cervical cancer, because it's the second most common malignancy in women worldwide.
Okay.
And that is after breast cancer. Breast cancer is the first, and it's a menace in our society.
Okay.
It affects some women, and it's not a nice experience. So it's good to learn about this. That's why we create awareness, tell women what they need to know, the vaccines they can take, and also how to prevent it.
Yeah, but looking at the ratio or the statistics in Nigeria, is it very high? And this cervical cancer thing happens to women alone, yeah?
Yes.
Yeah. So what's the stats in Nigeria, looking or focusing more on blacks and Africans?
Okay, cervical cancer generally it affects women. It's not based on the race.
Okay.
It's actually based on some risk factors.
Okay.
Like maybe an early age at the first sexual contact.
Okay.
And also having multiple sexual partners can expose you to having this cervical cancer. And also giving birth to a lot of children. There's more than 2 children can expose you. Yeah.
Okay. So when we talk about stats, right? Some people tell you, is it about 114,000 or 114? Because I had to go through some research myself, and I was seeing statistics. So how high is the figure yearly, and what's like the figure from last year?
Okay, considering previous statistics, it can happen in, let's say, 6 out of 10 women.
Wow.
Yes.
Wow.
Yes,
that much.
Yes.
Okay, so let's go into you now talking about what cervical cancer is actually. So then we'll continue from there.
All right. Cervical cancer is a cancer or malignancy of the cervix. Cervix is the neck of the womb, let's say. And that is the part that dilates or opens up for the baby to be delivered. So it's exposed to a lot of factors.
Okay.
It's exposed to like giving birth multiple times, or being exposed to what we call human papilloma virus, also known as the HPV. And that virus is transmitted from men to women via sexual contact. And in the presence of HPV and other factors, that combined together can produce what we call cervical cancer. So it's very necessary for women to go for screening as soon as even before they start having sexual contact. It's very important to go for screening.
Okay.
And you can do what we call a pap smear.
Okay. Yeah.
This pap smear, it's not an invasive test. It's not painful.
Yeah.
You just take a swab and then they test it. Yeah. And then they can tell you the results.
If you have that or not.
Yes.
Like you said, lots of women, maybe a few who are, well enlightened with regards to this, would know what it feels like to go for a pap smear. So So it's not something that anyone should be, so jittery about. Now, let's go into causes then of cervical cancer. You talked about environmental factors in the course of your explaining stats. So let's have you talk about what really causes it.
Okay, so 99% of cases of cervical cancer has been known to be caused by this HPV that I talked about, human papilloma virus.
Right.
Yes. And but the factors that can expose you or the risks are the ones I mentioned previously. That's the multiple sexual partners, and also having a family history of cervical cancer puts you at risk of having it. So it's important to check yourself.
So it could be genetic then, that's what you're saying?
Yes.
Okay, so environmental factors, when you mention that, what do you mean?
Environmental factors, mostly it's majorly like yourself. It's not to do with the environment.
Okay, so is it lifestyle then? And you're talking about having multiple partners.
Yes,
that
lifestyle
could be part of it.
Yes.
Okay, so besides genetics, you talked about age in the course of your explanation as well. How does age and having multiple kids affects one to being predisposed to having cervical cancer?
Okay, the age, as per the age, the peak age of that we see cervical cancer in women is usually 65 or more.
Wow.
Than 65, because by then all these things that would have happened would have happened. Like she would have given birth to so many children by that time. She would have been exposed to long-term exposure of HPV virus. Okay. So by this time,
so the HPV virus is gotten via sexual intercourse. So now let's talk about the age in where because I know several people will be interested in knowing the vaccine and all of that. So but you're saying that at that age 64, that's when it manifests. So all this while you don't know, and you don't go for maybe a pap smear or get treatment, and so it's accumulates into that. So how then do you deal with someone who has so basically what we're saying is have 2 kids and that's it? You shouldn't go beyond having 2 kids.
Basically, you can. By having more than 2 kids, it exposes you to it. It doesn't necessarily mean that if you have more than 2 kids, you will have cervical cancer. It's just the cumulative of all these factors. Yes. So if you know that you have a family history of cervical cancer, you just try and avoid having more than 2 kids. Avoid having multiple sexual partners because you're already at risk. Having this factor. Yes.
Okay. How about women who do not have plans to have kids? Because I got a message here from Blessing who says, how about women who don't have kids? Are they predisposed to having cervical cancer?
Well, women not having kids, it could reduce your risk.
Okay.
Yeah, it could reduce your risk, but it could also expose you to having breast cancer and maybe some other cancers. So it's, in a way, not having kids can expose to other ones.
But I mean, would lifestyle help you, like balancing everything up with going for checkups? Would that help so that you know when and what to do and all of that?
Yes, because sometimes this cervical cancer can be found on incidental findings. So you may not know, you may not show symptoms, but then you have it. There's a mass, and you also have HPV, but it's not showing symptoms. So it's good to just check yourself regularly, because you may end up finding, and then you can do something in time to prevent.
I mean, the earlier the better, like they say. All right, 090-7353-0044. Right now we're talking cervical cancer with Dr. Mercy Omachi. You can call the studio lines on 090-8766-AA. This is time for the ladies to come along or tag along and learn. If you're a guy, of course, you can help your woman or your wife, whoever it is, or your partner, so that you have this education in hand to help them. You can send a text or WhatsApp message to 090-9705-4450. You can call the studio lines on 090-7353-0044 or 090-8766-8888. Do join the conversation here this morning as we're talking with Dr. Mercy and ensuring that we are educated with regards to this. It's barely talked about, like I said. And do we have a world's, just like you have some World Diabetes Day, do we have like a World, Cervical Cancer Day?
Yes, we have.
When is that?
World Cervical Cancer Day is.
Yeah. Okay, so let's hold on that while we get that particular information out, and then would let us know, because I do know that there World this day, World that day, there's World Health Day, but there's a World Cervical Cancer Day.
Yeah, that's 17th of November.
17th of November. Anyway, so join the conversation. Like I said, you've got questions, send it to 090-9705-4450. But you can call the studio lines on 090-7353-0044 or 090-8766-8888. All right, the conversation continues here with Dr. Mercy. Any question you have, feel free to send those questions and messages to 090-9705-4450. Now we've got a question here from Christian Ofedo, who says, hello, OLIJE, great topic. Question for the amazing doctor. Does cervical cancer affect women of all races? That is from Christian. What is your reaction to this? Yeah?
Yes, of course. Thank you, Christian. Cervical cancer affects women of all races.
Okay.
And yes, it affects women of all races. It doesn't discriminate as long as you're a woman with uterus in the womb. Yeah.
Okay. Hello, good morning. Seems like we've got issues hearing you. Please, if you can, call 090-7353-0044 for any question with regards to cervical cancer. For the doctor in-house, we're about to talk about the symptoms of cervical cancer. Now, just in case you do not know, cervical cancer, according to research, is the second most common cancer among women in Nigeria. There were 31,955 new cervical cancer cases in West Africa. That was in 2018, and Nigeria accounted for almost half, which is 14,000 plus. There were also 10,403 deaths from cervical cancer in the country in the same year, that's 2018. So think about 2019, think about 2020, think about 2021. We are in 2022. So for such trends, I don't know if there's an uprising with regards to it, but that's the reason why we're having this conversation. So join in. Is that serious? So we can talk about it. Sorry, if you're having issues getting across, you can call 090-7353-0044 or 090-8766-8888. Those are the numbers. Let's go back to you now. Symptoms, someone who's listening can relate.
All right, so symptoms of cervical cancer can be abnormal vaginal discharge.
Okay.
That is offensive. Also an abnormal vaginal bleeding, pain after sex or during sex.
Okay.
And also maybe unexplained weight loss. Yeah. Those are the symptoms. And also bleeding when urinating. Just any sign of unusual bleeding. You're not on your period and you're seeing bleeding, an offensive smell.
Okay.
Just come straight to the hospital.
Are those the early signs, or because you did mention too in the course of your conversation that it's possible to have it and sometimes not even know.
Yeah.
So are those early symptoms then?
Well, some of them are early symptoms, but usually or sometimes when women come with some of these symptoms, they're already in maybe second stage. But at that stage, it can also be tackled. But when they come at the fourth stage and the final stage, it's usually difficult to...
Okay. All right, then. Now, let's talk about the issue with the age. Are there vaccines for those who are younger? From what age to what age can one take the vaccine with regards to cervical cancer?
Yeah. So the HPV vaccines are usually taken in either 2 or 3 doses.
Okay.
So for people less than 15 years old, they can take just 2 doses of the vaccine.
Okay.
But once they are more than 15 years old, and they can take 3 doses of the vaccine.
Okay, so more than 15 years. That's if you're 16 till what age?
Till whatever.
Okay, whatever.
Yeah.
Oh, because I thought, the vaccine is just for... Because I had a conversation, maybe not on the radio. Someone's like, if you've gone past 15, you can't have the...
No,
you can. All right. So, can you explain then, with regards having the vaccine, what does it prevents you from having it, and then Because some people say, okay, so since they've taken the vaccine, they can have multiple partners. Yeah.
So taking the HPV vaccine prevents you from contacting HPV. And the thing is, the vaccines we have available now protects you from only some certain strains of HPV. So we have the Gardasil, which prevents you from having the 6, 11, 16, and 18 strains of HPV.
Okay.
The Cervarix protects you from 16 and 18, while the Gardasil 9 protects you from 16 and 18 as well.
Okay.
So if maybe someone else, you find a new sexual partner and he has, let's say, I don't know, 2, strain 2, it won't prevent you from having that. So you still take the vaccine and you stay cautious.
Okay. So it's something, even after taking the vaccine, it means it's something you have to go for regular checkups for.
Exactly.
So, but how many times in a year do you advise women to go see a doctor? Is it once a year or twice a year?
So, it's advisable to take once you're less than that peak age, that's 65, you can go for just pap smear once a year. And if you don't have any alarming symptoms, you can take it just once a year. But once you're getting to that 5th decade of life or 6th decade, you should go for pap smear checks 2 to 3 times a year.
Okay. We got a message here from Amaka who says, OLIJE, I know of a woman that died of cervical cancer. Says she should be around her 40 to 45. She treated it the native way. Unfortunately, she didn't make it. So here's the thing about, is that the unorthodox way or orthodox way now, because the orthodox is the drugs and the prescription and all of that. So are there any cure to cervical? Because someone also asked the same question, not the orthodox way but the other way, because it's like some people try and they're like, oh, it's not working here, so let me try the other way. Yeah. But before you do respond, we've got this line ringing for quite some time now. Sorry, hello.
Hi, my name is Manuela.
Hi, Manuela. What's your question for the doctor?
I want to ask, I have a friend of mine that has ulcer, so I want to ask how she takes care of the ulcer.
All right, then. Thank you so much for calling. I appreciate you. We're not talking about ulcer right now. The doctor is particularly an expert with regards to the said topic. So sorry about it, but thank you so much for calling. You can call to ask your questions on 090-7353-0044. Call the numbers. We can take calls now, or 090-8766-8888. The topic we're discussing this morning is cervical cancer. So back to you. Yeah, you were saying, and before you go on, hello, good morning.
Hello, Angelina.
Hi, good morning.
It's Rukayat.
All right, Rukayat, what's your question for the doctor?
Please, ma, I'm busy. Can you give the pin for
Oh, no, send a text message, okay? Right now we're dealing with something else. Sorry about it, Rukayat. We'll see how we can pass it on to someone else. So let's go back to you now. So talking about we talked about the symptoms, yeah? Now we're moving on to what this lady talked about, unorthodox way to treat it. Is there anything like that?
It's very advisable
that
you come to the hospital and you get treatments in the hospital. It's not advisable to take orthodox treatment. So the treatments we have available for cervical cancer are based on the staging. That's why we stage the cervical cancer. Yes. So stage 1 and stage 2, it's possible for you to do surgery for the patient. But once it's getting advanced, it's spreading to the rest of the body, then we consider either radiotherapy or chemotherapy for the patient.
Okay, so stage 1 and stage 2 of cervical cancer. All right then. This one here says, OLIJE, please can the lady mention the symptoms again? Let us know. Can she explain these symptoms that she mentioned? Quickly, can you go through the symptoms again? You didn't send your name. Please, when you're sending a text or WhatsApp message, include your name. Can you go through the symptoms again, please?
All right, definitely. So bleeding, unexplained bleeding from the vagina. Offensive smell from the vagina or discharge, offensive discharge. Even constipation and diarrhea, because these symptoms can be seen in patients with cancer. So when you see someone is having constipation alternating with diarrhea, and also bleeding after having sex.
Okay. Yes. Right. So those are the symptoms so far. Guys, join the conversation. Let's have you come in and ask the doctor anything you'd like to know on the show. Someone asked, is there a cure to cervical cancer? Is there a cure to it? Any cure? Yeah.
For now, it's just this treatment methods that we have right now.
No cure, just treatment. Hello, good morning. Please switch off your radio set, guys, if you're calling. Switch it off completely before you have a conversation, all right? Please switch off your radio, okay? Else we'll have to let you go. The numbers are still open to you, 090-7353-0044. I keep giving the numbers because some people say, oh, you're fast on it. So I keep giving it over and over again. So the numbers again, 090-7353-0044 or 090-8766-AA. Hello?
Hello.
Hi, good morning.
Morning, my name is Bello.
Bello from where?
From Abuja.
All right, Bello in Asokoro. Talk to us. What's your question for the doctor here?
Yeah, my question is it possible for one to go to any hospital for this vaccine? Or is a particular hospital one can visit?
Okay. Good question. Thank you so much, Bello, and keep listening. She would react to that. Quickly react to that, please.
All right, so you can just walk into any hospital, either private or public facility, and just request for the HPV vaccines. And mind you, men and women can take the vaccine.
Wait, what? It doesn't affect men, but men can take the vaccine?
Yes, because
does this make sense? Because the virus. Oh, I see.
Yeah, so they can take it.
Wow. All right, guys. Let's take this call and have you ask your question. Hello?
Hello.
Hi.
Yes. My name is Manuela.
All right, Emanuela, what's your question for the doctor?
I think it's the ulcer.
Yeah. Oh, sorry, Manuela. Still the ulcer thing, though. We're talking cervical cancer. Okay, join the conversation, ask your question, and of course, she would respond to it. And the interesting part of it is, she just said that the men can also take the vaccine. So, for men who does it matter the age? For men, is it like the 2 doses or 3? How many dosage?
It's fine for them to take the 2 doses.
Okay.
Yes, and as long as they are sexually active. So from our society now. So maybe from age 12 they can take the vaccine.
Oh, okay.
At any age they can take the vaccine.
Okay. Sorry, we lost connection with you. Join the conversation. You've got a question for the doctor. Is cervical cancer, guys. That is area of expertise. So Emanuela has been calling with regards ulcer. But here is what you have to do. Send us a text or WhatsApp message 209097054450 and of course ask your questions while the studio lines are open to you as well. Now, having this kind of conversation, what pops up in some people's mind is, you talk about multiple partners. How about when I use protection? So does that work for someone who uses protection? Do they need all of this? Do they feel like, there's no need for any kind of vaccine? So what do you have to say about that?
All right, so we're glad that protection, condoms protect you from pregnancy, unwanted pregnancies and the rest, but it does not protect you from HPV. It does not, sadly. So your main protection should be your vaccine. Just be judicial with taking and completing your doses.
Is this such a big deal to go take your vaccine? Is this such? Some people take it for hepatitis and others. So this is one of those that you should take seriously as well. So it doesn't protect you from any of those as well.
No, it doesn't.
Wow, even with that protection. So all right, now let's move to other conversation now with regards the cure. Several people are asking about the cure. Are we on to you again? You can call 090-7353-0044. Any other question you have for the doctor in house, call 090-7353-0044, 090-8766-AA. This one here, hello again, OLIJE and your guest, of course. Please, what's the true scientific connection between early onset of sexual activity and cervical cancer? Let me have you answer that part first, because there's a part 2 to the question here by Chooks.
All right. So the early onset of sexual contact, or what we call coitus, is because when you are first exposed to HPV and for a longer amount of time, it gives the HPV the opportunity to act on your cells, on your cells in your cervix. So the longer you're exposed to HPV, the higher the risk of cervical cancer. So that's
Wow. Says, and is it true that women who never bear children cannot get this particular cancer? Yeah, many thanks indeed. That's from Chuk. So, yeah, you were talking about it, but also talking about how that if you do not have as well, you're also exposed to having other cancers, maybe breast cancer. So,
yes.
Reaction to that.
Yes. And funny enough, even if you don't end up having children, there are other risk factors like family history.
Okay.
So if you've not given birth to children, but you have a family history of cervical cancer, and also you asked me something about the environmental factor. Smoking is another factor. So imagine doing that for a long time and then other things.
Okay. All right, then. This one here, OLIJE, good morning. Enjoying the conversation and learning this morning. Thank you very much. Joining as well on 090-7353-0044. That is the number to call to ask the doctor your question. Let me just let this call come through. Hello?
Hello.
Hi, good morning to you. What is your name?
How can we prevent cancer?
Okay, what's your name?
My name is Peculiar.
All right, Peculiar. Thank you, Peculiar. Appreciate you. Preventive factors, of course. Now that we're dealing with cervical cancer, what are the preventive measures?
Okay, so she asked generally about cancer. She didn't say which one in particular.
That's the topic.
So in general, cancers, avoiding over-processed meals can prevent you from other types of cancers. Being exposed to X-rays for a long period of time or ultraviolet rays, and just trying to avoid the modern kind of lifestyle, if I could say. Yes, prevent you from having other cancers.
Okay. Because when you say the modern lifestyle, some people begin to wonder, what's the modern lifestyle? Are you talking about junks and some other processed foods like you did mention?
Yes.
All right, then. Let's move to some other question then, seeing that we've talked about protection. Because someone sent in a message, how about using protection? Can he prevent it? You already heard the doctor talk about that. Now, how much of the awareness is out there? I mean, I feel like there are times where we have to, us in the media sector, have to reach out before you have doctors, even coming. And sometimes the issue is they even tell you, oh, I don't have time, and all of that. So you begin to wonder, aren't these guys meant to, save, society or save humanity with regards to things like this? The whole of last year, I don't know that, we talked about some other forms of cancers, but cervical cancer, it seems like anything that has to do with women, the awareness is quite low. What are we doing to reach out to the rural communities as well, besides the urban centers? Yeah.
So, as medical personnel, we have ways of preventing certain diseases.
Okay.
So we have 5 levels of prevention. The first is just to do a general health promotion, talk about it like in the radio, like what we're doing now, on TV, talk about it in your neighborhood, just discuss it. And also when we see patients in clinic, even if what they come for is not related to maybe the cervix, we still tell them, do you know about cervical cancer? Do you know how to prevent it? Have you done a pap smear? So that's how we just put the word out there and create awareness.
Okay, so but rural areas, I know that in the hinterlands, these people barely, come to the city center. Are there strategic ways in which you think that these messages can be passed on to them?
Yes, by ways of medical mission.
Okay.
We can just travel, reach out to those rural communities, maybe learn their language and then try to communicate and tell them how this is rampant and how they can prevent themselves from having.
Okay. Now, let's talk about the area of government, because like I told you, the government has a role to play in this. And like I did mention, it will seem as though before now, women have been clamoring for, parts with equality or even equal pay and everything. Now, with regards ailments like this, I don't know that there's so much awareness, even with regards prostate cancer as well for men. But with this set topic, what do you think the government can do to measure up to ensure that in this part of the world we're doing what we can to encourage health workers such as you to, reach out to those communities we're talking about?
All right. So the government can help in ways of maybe creating or allowing some agencies in support of cervical cancer. Also approving bills, maybe cervical cancer bill if one comes up. Like last month we did a sickle cell bill.
Okay.
We had to go to the Senate, National Assembly, and just propose that these bills are passed. So if it's possible for these agencies to be created and help us increase funding, just help us to spread the word.
Okay, that would help. Okay, more questions here. I'll read your messages and more of your questions after this. Keep it here. 090-7353-0044 is the number to call. You're a woman, you're a lady out there. You need this information for maybe someone in the family or your friends, or as a guy, you could help your woman as well. So join in the conversation, ask your questions. You want to stay anonymous, feel free to do so, because I got a message here from someone, of course. You're welcome to ask your questions, all right? I'll go to the doctor and ask your questions shortly before we round things up here, discussing cervical cancer with Dr. Mercy. We still have several questions to answer. This one here says, OLIJE, please can you ask Dr. Mercy for me? If I've got pains during my cycle, sometimes discharge outside my cycle, and sometimes terrible pains before my period, doesn't mean that I have cervical cancer besides the symptoms she's mentioned. This person wants to stay anonymous, so can you react to her?
All right, so these symptoms, having them does not necessarily mean you have cervical cancer. You still have to go for screening, and then if you come back with an abnormal pap smear test, they'll go along to do a colposcopy.
Okay.
Yes, and then they'll just take maybe samples from there. That's if they see an abnormal pap smear test and then they see a mass. But having these symptoms doesn't automatically mean that you have cervical cancer.
Okay, so basically cervical cancers come in form of a mass, because then how do you differentiate between that and fibroid? And those fibroids graduate into being cancerous?
It's possible for fibroids to transform and become cancerous, but usually they don't.
Okay.
So fibroids usually they have a certain aspect. Yes, that to differentiate them from cervical cancer.
Okay. So when you go for the test, that's how you know. All right, then now let's move into Chuksi's question, which is the question I was going to ask before we round things up, talking about preventive and curative measures. So he says this is something that affects the women folk, but what really can men do to put this cancer at bay as regards the women in their lives? By the way, where does Nigeria rank internationally when it comes to prevalence? So let's talk about the first part of it. What can men do to put this cancer at bay with regards to women in their lives? Yeah.
All right. So the first question was about how men or what they can do to help the women in their life. So you can take a first step by taking a vaccine.
Okay.
And you can also, if you notice any symptoms with her, just advise her to go to the hospital. Even if it's your mother's and maybe they're having these symptoms, but they want to do it the unorthodox way, just advise them to go for screening.
Okay.
Yeah, but what you can do by yourself is take the vaccine.
So, baby, do you advise as a woman before taking the vaccine, you go for the test to be sure that you don't have it? And if you have it, do you take the vaccine?
Yes, definitely. You have to go for the test first, confirm that you don't have
that is the pap smear.
HPV, yes.
Yeah, okay.
And then you go ahead take
for the vaccine. Yeah. All right, but guys, they can just take it. And you said from ages 12 and above.
Yes.
All right, great. So, preventive measures here. What can we do generally as society? What do you advise people to do to ensure that this stays at bay? He talked about where we're ranked internationally with regards to prevalence. What's your take on that?
Okay, because we don't really collect data. We don't have
that's a big problem.
Yes, the habit of collecting data in Nigeria. It's hard to tell where we are standing, but the rate of cervical cancer is quite high in Nigeria. It's quite high. So
okay. So how about the vaccines? Are they affordable? Because I know that when it comes to, because we've been talking about HPV vaccine, Bello in fact called in and said, okay, can I walk in anywhere? Does the price differ from hospital to hospital? private hospitals are quite different and pricey.
Yeah.
So how do you, is this something that's affordable for Nigerians?
Yes, the HPV vaccine is quite affordable. There are some hospitals that have it for 11,000 naira per dose.
Okay.
I'm sure it would be less in maybe in a general hospital, in a public facility. So it's quite affordable.
Okay. All right then. So if you've got a child, a girl child, they could get vaccinated from what age again, for parents listening?
Yeah, from 11 to 15.
11 to 15.
Yes.
While as an adult, you have to go for the test, pap smear, and then you get vaccinated if you do not have it. All right, Dr. Mercy, final advice for women listening, for everyone in general.
Yeah, my advice to women out there is be cautious of yourself, study yourself. If you notice anything wrong or strange, please go to the hospital, check yourself, and protect yourself.
That's it. Thank you so much, Mercy, for coming through this morning. Really appreciate you. And the text and WhatsApp messages, the calls. I appreciate you guys as well. For you, Manuela, your friend talking about ulcer, what you can do is ensure that your friend goes to a nearest hospital to, ask a doctor a question or go for a test or something so that they can advise her specially. Thank you so much again for the calls, the text, the WhatsApp messages. The show continues, and of course 12 we have today in 60 after the Urban Hour Royal Conversation.